I am on the air. I don't have anyone yet. Let's see if someone comes up. I haven't seen my people in a while. We've been on spring break and just doing a multitude of things in the office. So it's an exciting time. Let me see, when are we coming up? I wanted to talk a little bit today about hormones. People might be in rush hour traffic. I'm not really seeing anyone yet. I will speak a little bit right now. I'm going to be, we are going to have a lunch and learn in the office on Wednesday, April 24th at noon. Dr. Patrick Flynn, the hormone whisperer, will be in the Charlotte area, and he has so graciously will be coming to speak with my patients and anyone who wants to hear more about health and hormones. If you look him up, like I said, he's the hormone whisperer. His story is very intriguing. He had to find a way for his wife to become healthier. They told her she could not have any children, and now they have 4 beautiful girls. So his research, his just trying to find the truth has helped so many other chiropractic offices and other medical offices in this country find a way to help people to function better and get better. And I wanted to talk a little bit today about the options for women who feel like they're having hormone issues. I am not absent from that number. Of course, I am, well, not of course, but I'm 43 years old and I feel like my hormones are changing. Hey, I think that was Shanae. I feel like my hormones are changing. In fact, I know they're changing because I'm seeing different things going on. Some acne here, which I got a couple of years ago, and went into a dermatologist who prescribed me spironolactone and a couple of other acne medications. And I have now done some research on that particular medicine, and it turns out it is an endocrine disruptor. So while it was, and it's not really for acne, it's a heart medication. So I had to get my potassium checked. My potassium was okay, and so he put me on it. But it's also an endocrine disruptor as well. So in treating my acne and helping my face, it was possibly disrupting the endocrine function of my body, which is not okay. That's one episode of things that are used to help with hormones or hormone imbalances that you should not do. Another thing that I've heard a lot about is when women have hormonal issues, or even menopausal women, they are being put on birth control pills. Birth control pills are also an endocrine disruptor, which is not good for your body. Also, when you are being put on birth control pills, I would urge you to have your hormones checked, because if they're not checked and the wrong hormone is being used in your hormone imbalance, then it can make things worse and not better. I've heard a lot about the pellets, bioidentical hormones, and that kind of thing. It works for some people it does not work for. I would still urge you to have your hormones fully checked. And so, having them fully checked means having all of the estrogens checked. There are 7 chemically similar compounds that make up the estrogens. Most of those are not checked when the hormones are checked. Testosterone is very important in women, especially as you're getting older. You want your hormones to be at a certain level. Cholesterol is important in your hormones. We teach a flow chart on how cholesterol can help out with the hormones and making sure that your hormones are healthy. Your gut is very important in your hormones. Hey, your gut is very important in regulating your hormones. So if you have leaky gut or you're ingesting toxins that are making you have leaky gut, then that's a no-no. Food allergies are very important to know. Food sensitivities are very important to know. I had a patient come in the other day and she is sensitive to kale, chia seeds, hemp seeds, yeast, bakery and brewers, cheese, dairy, eggs, all of those things. But of course she loves eggs and all those other things, healthy things she was doing, and she couldn't figure out why she still was bloated and why she was not feeling better. So it's just those things that you can do and you might not know to do that can help you to be a healthier person and to feel better. All of these women that I've talked to that were on birth control or were on a hormone replacement therapy all had brain fog, which is common as you're getting older, but it can be alleviated and it can help. There are ways that you can exercise your brain as well as getting your hormones balanced in order to feel good and not have brain fog and not have to find your words. As you see, I sometimes have to find my words, and that's why I'm trying to get my hormones balanced myself. So, just question. And I've said this many times. When you go into your doctor and you're being put on a medication for an indefinite amount of time, question, why am I being put on this medication? How is this going to help my function? Do you have an end game? Do you have a plan on how this is going to help my function and how we're going to test it to make sure that I'm not on it for any longer than I need to be? So, just in speaking with women in the past couple of weeks, I just want you to be your own advocate. Ask questions. You deserve to be able to ask questions. They're not supposed to get mad at you if you ask questions. I tell you, people don't have any problems asking me questions. They don't have any problems asking about every supplement that I may suggest to them. They have no problems asking what tests I'm taking and all those things. So I don't understand why you would have an issue speaking to your medical professional about the things that they want to put you on or the things that you are being tested for. So that's really kind of the point of what I wanted to talk about today. I didn't want it to be too long. Hey, Queen, how you doing? I didn't want it to be too long, but I just want you to be your own advocate. If you're not happy with what's going on with your body, then the only thing you can do is question and find the answers that you need to find in order to be a healthier person. Another thing, infections for some reason are very common in this day and age in the body. And so if you're not feeling well and you can't find a reason why you're not feeling well, you always want to try to figure out if you do have an infection. Atypical infections can be in your gut. That's just when you're miss you too, Queen. That's just when the microbiome, the gut microbiome, which is a healthy balance of bacteria and yeast in your gut, is off. And so if it's off and you have bad bacteria in there that's overgrowing, then that can affect you. You can have constipation, diarrhea, hormonal imbalances, your immune system can go down, you can feel nauseated, you can feel sick, you can have skin issues. All of those things can come about if you have gut issues. Another thing that's not really typical but can be common in people is viral infections, underlying viral infections that people may have. Epstein-Barr, cytomegalovirus, if you don't feel well, then there could be a reason for it, and you need to seek out and figure out what that reason is. If you feel like something is going on and your doctor is telling you that you are healthy, then you need to find those answers. We only get one life, and we have to take care of ourselves and take care of our bodies while we're here. So that's what I would suggest. I would suggest you just be an advocate for yourself. Take care of yourself. Make sure that you are getting your tests done. Make sure that you are eating the right foods. I've spoken about it many times. Organic foods are going to be best for you. Non-GMOs are going to be best for you. Grass-fed meats, if you're going to eat meat. Grass-fed cow, grass-fed chicken. Dairy, if you're going to have dairy, it needs to be grass-fed. There are substitutes for dairy. There are substitutes for sugar. There are substitutes for gluten. There are substitutes for anything that you can figure out. It is not going to be the end for you. It's actually going to be the beginning for you to figure out how to feel good and how to live your life to the fullest and be a healthy person. So anyway, just ending, the pH balance where? In your body as a whole. So you want to stay away from acidic things. You want your body to be alkaline in nature. And so, of course, you want your stomach to be acidic. There are certain places in your body that need to be acidic. Your stomach is one of them. It needs to be about a pH of 2. So, you want to get away from the acidic foods, and that would be some of the meats that are acidic. Clean foods are usually not acidic, so you want to stay with them. Hey, Donna. You want to stay with foods that are going to keep your body alkaline. Acidity is not good. But Queen, if you have any specific questions, just, you know my number. You can call me or you can message me if you need to. Well water. Okay, well water can be good. I would suggest that you get it tested to make sure that it's, doesn't have any heavy metals in it, and it's healthy. It has a healthy mix of minerals and for you. So there are tests that you can do on your well water to test the pH of it, and also to test to see if it has any impurities in it. I used to drink alkaline water, and I don't feel like anything's wrong with alkaline water, but I've come to learn that spring water is best. I actually drink reverse osmosis water from Earth Fare. So I go fill that up. I have like 3 5-gallon jugs that I go fill up. With 3 kids in the house, really 5 people in the house, I fill it up about every 2 weeks, about 3 of them. I try to cook with it. I try to, put it in my pots and drink it and all that stuff. So you have to be careful of that. Another thing that you need to be careful of is plastic containers. You need to start moving more towards glass containers when you're storing your food. The plastic can leach into the food and cause different things. Okay. I think that's it. Okay, so I was just talking a little bit about hormones. We are having a lunch and learn on Wednesday. Thank you. I appreciate that, Queen. You're so sweet. We are having a lunch and learn on Wednesday with Dr. Patrick Flynn, the Hormone Whisperer. It is at 12. There is a link in my events for the tickets. They are free. So if you are in the area and available at 12 o'clock, that would be a great information to catch if you're in the area. Okay. Queen, message me if you have any more questions. We'll talk to you later. Thank you.